Everyone, in this session we are going to discuss a small topic, that is pyloric stenosis, which you get as a short question in your university exam. So let's start the topic. Pyloric stenosis. Here you can see we are starting. So just I will let you know what is pyloric stenosis, what are its types, and what are the clinical features. That's all about it. You get a short or very short question on that. So before understanding the topic pyloric stenosis, you must understand the layers of the stomach. So in the stomach, in the gastric wall, in the stomach wall, we are having 4 layers as a complete GIT. So innermost one is the mucosa. You can appreciate it here. So innermost layer is the mucosa. This one is mucosa. Just below the mucosa, there is submucosa. So you can appreciate this one is submucosa. Below that, there is muscularis propria. Now, please understand, this one is muscularis propria, and the outermost one is the serosa. So you can appreciate this one is serosa. Now, the muscularis propria is further divided into 3 portions. Let me show you the 3 portions. So if we cut the wall of the stomach like this, we can see the various layers like this. So innermost is mucosa. We all know the innermost is the mucosa. You can appreciate it. Here there is mucosa. Just below the mucosa, there is submucosa. So you can appreciate submucosa also. Now come on the muscularis propria. I want to tell you the 3 layers, the 3 different layers of the muscularis propria. In the muscularis propria, there are 3 layers. You can appreciate the innermost one is the, you can see it oblique. The middle one is the circular, and the outermost one is the longitudinal. So oblique, circular, and longitudinal. These 3 layers overall constitute the muscularis propria, and outermost one is the serosa. You can appreciate this one is the serosa. So these are the 3 layers of the muscularis propria of the stomach. You can appreciate it. And one more thing I would like to tell you here, at the junction of the stomach and the duodenum, there is a sphincter. This is known as pyloric sphincter. Can you appreciate the pyloric sphincter? So this pyloric sphincter also have these 4 layers at the junction of the stomach and the duodenum. So this is esophagus, this is stomach, and this is duodenum. So at the junction of esophagus and stomach, there is a sphincter which is known as lower esophagus sphincter. At the junction of the stomach and the duodenum, there is another sphincter which is known as pyloric sphincter. Pyloric sphincter. So that is the basics we have understood. Here you can see the walls again. Innermost layer is mucosa. Let me highlight the mucosa for you. This one is mucosa, the innermost one. After mucosa, there is submucosa. So you all can appreciate this one is submucosa. And after that, the 3 layers of the muscularis propria. So this is oblique, this is circular, this is longitudinal, and outermost is the serosa. So this is muscularis propria, the complete muscularis propria. Now let's come on the topic pyloric stenosis. What is pyloric stenosis? As the name indicates, pyloric stenosis, it's a disease which occurs at the pyloric sphincter. So pyloric sphincter is present at the junction of the stomach and the duodenum, that sphincter. Now this sphincter also have the 4 layers. Now in the muscularis propria, the circular layer of the muscularis propria undergo hypertrophy and hyperplasia, that get thickened, and because of which the sphincter get closed. So there is no passage of food from the stomach to the duodenum. It get closed, it get very narrowed. The lumen get very narrowed at the pyloric stenosis. So normally in the pyloric stenosis, sphincter, the sphincter is like this. The sphincter is like this. So whenever there is a food in the stomach, the sphincter opens and the food passes from the stomach to the duodenum like this. The food is passing from the stomach to the duodenum like this. Now, but imagine the wall of the sphincter get thickened. So lumen become very narrow, it become closed. So the food cannot pass. Food cannot pass from the stomach to the duodenum. Why the wall become very thick? Why the wall of the pyloric stenosis, pyloric sphincter become very thickened in pyloric stenosis? Which layer it is getting thickened? The circular layer of the muscularis propria. So in the muscularis propria, we are having 3 different zones: oblique, circular, and longitudinal. Out of these, the circular layer undergo hypertrophy and hyperplasia. It get thickened, and it is narrowing the lumen, closing the lumen, so food cannot pass from the stomach to the duodenum, and the patient vomits very frequently. Patient have weight loss because patient can't eat the food. Patient have fatigue, lethargy. That is the thing. So that is pyloric stenosis. So what's the definition of pyloric stenosis? You can frame the definition by your own. It is hypertrophy and hyperplasia of what? Of the circular layer of the muscularis propria. Where? In the pyloric stenosis. So that is the thing. You can see at the pyloric sphincter, you can see this is the pyloric sphincter. It is undergoing hypertrophy and hyperplasia, so it is closing the lumen. Appreciate there is no space.